your rheumatologist may decide a biologic medication is the best treatment for your disease. Biologics inhibit a specific part of the immune system that causes inflammation. Because your body cannot absorb biologics if taken by mouth, they must be given either by an injection or by an intravenous infusion. That's a medicine given in the vein. Today we'll discuss what it means to receive infusion therapy. The place where you receive your infusion usually contains comfortable chairs or recliners. You may want to ask in advance about the temperature in the infusion clinic. You're welcome to bring a light blanket and a pillow if they're not provided. You should wear loose-fitting clothing that are comfortable, and you will want to drink plenty of water the day before and the morning of your infusion. This helps to avoid any difficulty in starting your IV. Depending on the medication you receive, your infusion may last between 30 minutes to about 5 hours. You may want to consider bringing a book, music, a tablet, knitting, something with you to pass the time. You may also want to bring a snack in case you get hungry. Before your infusion begins, your nurse should ask you a series of questions. Have you had tests for tuberculosis and hepatitis B? Were these tests negative? What allergies do you have? Have you ever had a reaction to a biologic medication, either given by injection or by infusion? Are you currently ill? Do you have any signs or symptoms of infection like fever, nasal discharge, productive cough, or pain in urination? Have you been anywhere where you may have been exposed to an unusual fungal infection? Are you currently taking an antibiotic? Do you have an elective surgery planned in the next 3 months? Are you pregnant or breastfeeding? And what other medications are you currently taking? Once you're settled into your chair, your nurse will check your vital signs like temperature, blood pressure, pulse, and then they will insert a catheter into the vein. Usually that's in your hand or arm. Then the medication will begin. Some infusions may require that you have a pre-medication, a medication beforehand, such as acetaminophen or Tylenol, diphenhydramine or Benadryl, and this helps decrease the chance of you having a reaction. You may be instructed to take these medications at home, or they may be supplied to you at the infusion center. Most people don't notice the fluid dripping into their IV site, but some people do say it feels a little cool or they get a funny taste in their mouth. Sometimes an IV can become slightly displaced. This causes fluid to come out of the vein and causes the tissue around the IV to swell. Let your nurse know if this happens right away. During and after the infusion, ask questions if something does not seem right. There's a possibility, although rare, for an allergic type reaction to occur. This could be mild itching, hives, swelling, as well as changes in your blood pressure. Notify the staff immediately if you are not feeling right. Reactions can be treated with additional medications and sometimes just slowing down the speed of the infusion. A dressing will be placed on the area where your infusion was done, where your catheter was. This should be kept in place for about 30 minutes or longer after the infusion. Again, after your infusion is completed, make sure you pay attention to any particular instructions and make sure you know who to call if you have any questions or you think you may have side effects, such as rash or a fever. Infusions do not take the place of your regular appointments with your rheumatologist. It's important to keep those appointments so that you can be monitored to find out how well you are responding to your new treatment. Thank you.